Hi, I'm Jayne. I live in the Northeast. I have a yellow lab. She's 11 years old. Her name is Ella Rose, and she's a very active dog that we adopted at the age of 6. So we really noticed a difference in her, a change in her, when she stopped wanting to go out for her walks, when she wouldn't walk as far, when she hesitated going into and out of the river and going up and down stairs, jumping in and out of the car or the vehicles, and also jumping up and down off the bed, of course.
My name is Marta Agrodnia, and I am a boarded surgeon and owner of Portland Veterinary Emergency and Specialty Care in Portland, Maine. Ella Rose was an 11-year-old female yellow Labrador Retriever that had been adopted as an adult through a rescue organization. And when I first met her in April, she had a severe left forelimb lameness that at times was non-weight bearing. It was so painful she wouldn't put the leg down. She actually suffered from elbow dysplasia and arthritis secondary to that in both of her elbows. The left was just much more progressed. And the owner had tried everything over a period of 5 years to help her, but the condition continued to deteriorate and get worse.
After exploring all of the options, I think that we had the surgical options, the treatment through medication, etc. It seemed the best choice for us to try the Synovetin OA. It was so much less invasive, much less of a recovery for an active dog, and we felt that it was something that we wanted to pursue and see if we could find a vet somewhere in our area who was using that new treatment.
Synovetin OA is a minimally invasive elbow treatment that has no negative side effects to the rest of the body. We injected into the joints, and specifically for her, the elbow joints, and is locked into that joint. It's not going to have any negative effects with her liver or her kidneys or her intestinal tract. In Ella's particular case, other systemic treatments had not worked, and so we wanted something that had the potential to be long-acting. And the Synovetin, in mild cases of arthritis, has a 92% efficacy for elbows, and in more advanced cases has about a 75% efficacy.
We're so very fortunate that we had the opportunity to use this treatment with Synovetin OA. I feel so happy that my dog, who really was losing her ability to walk, is now able to get out and play and do the things that she normally does. She's only 11, so as a lab, she needs to have that activity level back where it was. And I would hope that everyone has a chance, if they have a dog with this issue, to be able to use this treatment. I really am so pleased with it and so happy that our dog is getting back to normal.
I would recommend Synovetin OA for all of these young dogs that have elbow pain, that have early onset of elbow dysplasia, elbow arthritis, because it has such a high rate of effectiveness at 92% with such a long-acting treatment of a year and oftentimes longer, with no side effects, no adverse side effects to the patient. And in my hands thus far, it's been very effective in getting these animals back to being comfortable and functional and running around again, happy dogs with their owners.
She's a happy dog these days, and it's so good to see that tail wagging again.